I was recently awarded a Leadership Common Grant, and I feel incredible privilege about it. With this grant, I'm going to have the opportunity to continue some of the work that I've been doing, really focusing on the impact of treatment completion, treatment initiation in disparities. As you'll know, as new treatments evolve, our treatments are getting longer, are getting more complex, and some of these drugs are associated with more side effects. And I really want to ask the question, what is this impact in terms of completion of treatment, or patients with lower socioeconomical status or different races, or patients that have been marginalized historically, less likely to complete these treatments and therefore having worse outcomes. And once we can identify those patients, how can we help them? How can we really help our patients receive the treatments that we're so proud of? So it's a research that touches on disparities, that touches on toxicity, that touches on financial toxicity, that touches on determinants of health, and I think it can give some really interesting questions to the practicality on how we get patients to complete therapy. Something that we really in my team want to evaluate is this more holistic approach, really trying to understand the problem from the many different angles that it has, because access and delivery of treatment, it's incredibly complex. And this of course brings the issue of policy, and some people can wonder, can policy also impact the outcomes of our patients? And I'm a true believer that actually it can. Something that I have done with evidence, it's asked the question, what has the impact in breast cancer outcomes been of something like the Affordable Care Act and Medicaid expansion? When Medicaid expansion was incorporated in many states, more patients got access, and that's something that has been described. My team has asked the question, has the survival of patients with metastatic breast cancer changed based on the implementation of the Affordable Care Act? And we actually observed that in states that implemented Medicaid expansion in January 2014, the 2-year mortality rate of patients with metastatic breast cancer diagnosed with stage 4 de novo improved. We are currently evaluating the impact of time to initiation of chemotherapy with very similar results. This study is going to be published hopefully very soon, and we're going to present at the podium at the Surgical Society of Oncology a very similar question evaluating time to surgery, because maybe with evidence we can demonstrate and answer a question whether some policies can impact the outcomes of our patients.